Hello, good evening. How are you? The time is 8 p.m. here in Nigeria. My name is Dr. Frederick Unwibohai, and this is Ask the Doctors. This program holds every Sunday from 8 p.m. to 9 p.m. West African time. Now, on today's program, we'll be talking about hepatitis B infection and your health. A lot of people have been asking me, Doctor, please talk about hepatitis B infection. So I have decided that we'll talk about hepatitis B today. I am the host of the program. This program has been going on for the past 5 years, and my co-host is Dr. Irobonose Israel. He'll be joining us very soon. Now, before I continue, I want you to tell me where are you watching me from? I'm live on Facebook. I'm also live on TikTok. I'm live on YouTube. I can't see the comments from Facebook, and I don't know why. The people who are watching me on TikTok, I will have to end the TikTok live very soon. So they will need to come to YouTube to continue the conversation. But right now, tell me, where are you watching me from? If you can hear me, you can see me. Tell me, where are you watching me from? Happy Sunday to you. Yes. So you on TikTok, I will end the live session very soon. Go to YouTube. I'm not taking questions here. I'm sorry. Go to YouTube. I will end the TikTok live very soon. Yes. Okay. Yeah. The people on Facebook. I can see your comments. Finally, thank God. Yes. 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 I can see you. So let me see. Diva. Diva. Good evening. Diva is watching me on YouTube. Acheson. Acheson on YouTube. Good evening. Diva Licious is watching from France. Diva, I see you. Happy Sunday. Happy Sunday to you. And if you're watching me on Facebook, just let me know. Tell me, where are you watching me from? I hope I can see your comments. I don't know what's happening this evening. So let's talk about hepatitis B infection. The people who are watching me on TikTok, you will have to go to YouTube. I will end the TikTok live very soon. Hmm? Uh-huh. You know now, I will end TikTok live. Okay. So let's start this evening. When you hear the word hepatitis B, what comes to your mind? Oh my God, make I go back to pidgin English. Sorry. I have to switch back to pidgin English. Sorry. Let's go back to pidgin. So when you hear the word hepatitis B, waiting they come to your mind. Waiting you think say it be. Dr. Israel is in the house. Okay. Dr. Israel, if you can hear me and you're ready, give me a thumbs up, huh? Okay, cool. Let me bring you up. Let me bring you up. Yeah. Dr. Israel, good evening. How you day?
Good evening. I'm very fine. Happy Sunday. Happy Sunday to everybody that came when come join us today to
Yes, yes,
listen
yes.
to today's topic.
Yeah, happy Sunday to you. Welcome. So I never even start where you just enter. And this topic now very interesting one because a lot of people no really know about hepatitis B. Some people will know about hepatitis B, they fear. Like the moment they hear about hepatitis B, their mind go they beat very fast. So I feel it's important we talk about hepatitis B infection this evening. Waiting it be, waiting they cause them, how person they take get them, waiting be the symptoms. If person get them, the person life don't end. I be hope see day. Waiting be the treatment, waiting be the cure. These are all the things we want to talk about tonight. But first of all, make you understand, say hepatitis B infection, they very common. A lot of people don't know say they get them. Hepatitis B, they kpai people very well. And you can prevent it. Hepatitis B get vaccine where you fit take prevent them, but a lot of people don't know. So hepatitis B in a virus. We get many, many types of virus, many types. But this one, now one of the virus who they call hepatitis B virus. And na the liver it dey attack. E dey enter the person body, go come dey there, come dey there, come dey there. Sometimes you might be lucky, your body fit clear am, the acute infection. If you clear am acute, e go comot. But when e come enter chronic, if you come enter, come pass, come go to the next level. So make I hand over to Dr. Israel, may e continue from here, and then we will go to the next phase. Dr. Israel, over to you.
Okay, thank you. Now, Dr. Fred, don't give us more introduction on hepatitis B. I just also want to add for hepatitis. So hepatitis now a group of virus when they affect the liver, and we get hepatitis A, B, C, D, and yeah, I think E. So these are not just group of viruses like that, and they are all called hepatitis. But they call them hepatitis. They can't get those different type when be A, B, C. So today we now the B we dey talk about uh, today, because the B na dey somehow common pass for more than the others, and then the B also dey very e dey very, as I would say put am now, the B just be like HIV. Yeah, let me use that word. The B, hepatitis B, it just almost be like HIV. And it's also one of the chronic disease when we know. So it's a chronic disease when get so when fit affect the liver. So if when e affect the liver, e fit affect the liver to the ex ten t say e fit come cause liver cirrhosis or even liver cancer. Yeah. And this hepatitis B na something when dey transmit from one person to another. So if one person get hepatitis B, e go fit transmit am to another person. But as we dey talk, we go tell you how this thing can be transmitted and other things wey we know about hepatitis B, wey some people think say e can happen that way, but we go let you know the ones wey be really true and the ones wey no be true. Now the chronic form of hepatitis B dey very not really too good. And also I want make you know today say hepatitis B, yeah, cannot be cured. The chronic type of hepatitis B cannot be cured. um Don't worry, as I talk, this one na just introduction. As we dey talk more, we go fit I go still tell you some few things wey you go need to know when we talk about treatment of hepatitis B. But first of all, just know say e cannot be cured, however we can manage it. And it's also good say make you know say yes, it is preventable. It is preventable and lucky, very good to know that hepatitis B get vaccine. So if you never take hepatitis B vaccine and you dey here dey hear our voice today, e make sense say make you go test yourself. First of all, be sure say you no get hepatitis B, and when you test yourself say you dey negative, e go good make you go take the vaccine so dat you go prevent yourself from being infected in future. Also, person fit get hepatitis B and e no go know immediately say e get hepatitis B until dis hepatitis B don dey cause problem, serious problem to the liver. As HIV be, you know some pipu fit get HIV and dem fit stay for long time before dem come find out. The same thing with hepatitis B, dem can stay for a very long time before dem go even come find out say dem get hepatitis B. So dis one na just my own form of introduction about hepatitis B. And Dr. Fred already tell you it's a virus, no be bacteria, no be fungi. So no antibiotics, no antibacteria, um antibiotics, okay, yes, antibiotics. No antibiotics dey wey you say okay make I take antibiotics make e comot hepatitis B. The only drug wey we dey take na antiviral medication. Dr. Fred.
Yes, Dr. Israel, thank you so much for that wonderful introduction. Now, if you dey watch us for Facebook, and maybe you wan ask questions so that I go fit see am, abeg hurry up, enter YouTube because the Facebook head dey shake. You understand? Those of us wey dey do Facebook. So go to YouTube so that as you dey drop comments, I go dey see am, I go dey put am for screen. I go fit take your questions. Now, for the people wey dey see us for the first time, the both of us, we are licensed medical doctors. So we are trained, we get license, we dey treat human beings. Don't be say we just wake up, they talk about health. And we dey here to teach you so that may you know some things. But remember, we not go give medicine online. We not go make diagnosis for you here. If you get any sickness, you go have to go to the hospital. Now, for hepatitis B, wetin can make am say it is spread? Because Dr. Israel mentioned one very important thing. Say some people go get them and they no go know. So you fit get them, you no go know. Somebody fit get them, and if you are not careful, the person fit pass and give you. One very common way where people say they get hepatitis B, na through intercourse, that is through sex. When a man and a woman meet, that is one way you can get in contact with the virus. Now, the funny thing about this virus be say the virus dey very very strong. E no dey die quick, so e can last long. And when e enter the body, if you no know, if you just sit down there, if e come spread from one person, dey go like that dey inside the system. But for those of us wey dey work for the healthcare system, we dey talk about am say vaccine dey go prevent you. Say make you collect the vaccine, because as you dey work with patients, there is a high chance you dey more at risk to carry the virus enter your body. So health workers dey collect the vaccine, and they don talk say if you take the vaccine within the complete dose, e fit protect you for up to 20 or 30 years sef, country like that. Why most people no even know anything about the virus. So I don tell you one way wey person fit take get the virus. Another way again, then I will hand over to Dr. Israel. Maybe na through sharp object. Sharp, a lot of people dey do things you no go know. Something fit just cut you. If you just take blade, one thing, your mind no go dey there. But the thing fit just dey go enter the person body, go come spread. As I round up this one, make I hand over to Dr. Israel. Your immune system again dey very important with the whole stuff about viral infection. Because for most cases, at the acute phase, when e just enter, if your immune system dey intact, dey okay, dey protected, nothing dey happen, the acute infection, your body fit fight am as e just enter, body fit fight am well well. But for some people, most people, the immune system no fit do anything. So Dr. Israel, over to you, abeg.
Okay. And Dr. Fred don't talk one way when person fit take transmit the virus. And one way. Now, before we continue to talk about ways when this virus can be transmitted, we could just look at which where this virus can be found.
Hmm.
Where would they fit see this virus for person body? One, the major part na the blood and the bloodstream. So the blood and blood products. When we say blood and blood product, everything wey dey concerned with the blood, you go fit see this hepatitis B fit dey there. Then that na one. Two, semen wey men dey produce, Quickus fluid, e dey there. The virus dey there. Our saliva, the virus dey there. The breast milk, the virus dey there. Our sweat, the virus dey there. But don't get it twisted. I go talk so many things under this place when I dey talk now. Yeah. And this our sweat, the virus dey there. Yeah. So most part when this virus dey na actually mainly the blood and the blood product. So anytime you come in contact with the blood and blood product of somebody wey dey infected, there's high chances say you fit get the virus. So na make most of the time one set of people wey dey quick dey infected na healthcare workers or anybody wey dey work with blood and any other product wey dey with blood. So such knacking, person fit get am through there, fit transmit am. That's unprotected knacking. So we not just say knacking, but unprotected knacking. Two, um blood transfusion, needle stick injury, and mostly those are go happen for mostly for healthcare worker. Child from mother to child during childbirth. Mother to child during childbirth. Another one na when you go use the sharp of somebody wey get the virus and you no know say you don injure im hand with those sharp and you come go use am. That's why we dey always dey advise. In fact, it's not compulsory that you know say somebody get one disease for im body na make you no use the sharp. It's very important that you should get your own sharp, not use another person sharp. Basic that na basic stuff. That not because of hepatitis B, but that na basic stuff. So when you use other people sharp, there's every tendency say you fit come down with hepatitis B. Now, I don't mention this way, but you know say I say this virus you fit see am for sweat, you fit see am for breast milk. But studies have shown say I fit even dey the saliva, but studies have shown say you no go fit get dis virus through kissing, because the one wey dey the mouth is not enough to cause the infection. However, if that maybe there is an injury in the mouth, there is injury in the mouth wey be say blood come join the saliva, problem fit dey. Two, the one in the sweat is not enough to cause the infection. It's not enough to cause the infection, except maybe the person get injury for the body and the sweat come mix with blood. That is the only way e go fit take get the virus. And also, mother no go fit give im pikin through breast milk. There's no transmission through breast milk. This because there are so many things when you know say the baby himself during immunization, na make e dey very good say you go immunize your baby. When you give your baby those immunization, you are actually protecting your baby. So during breast milk, the baby no go fit get the virus. Now only through childbirth na the mama fit transmit the virus to the child. And you should know say if the mama get the virus and during childbirth, after birth, they give the pikin one drug like that, wey dem dey call immunoglobulin. If dem give the pikin that drug and within 12 hours give am the first dose of hepatitis B vaccine, that pikin no go fit get the virus. Yeah, that pikin no go fit get the virus. So I don mention those how person fit take get the virus, and I don say you try to let us know why I dey talk this one, because we go still go front and we go still talk some other things. I don say let us know say if you get somebody through kissing, you no fit get the virus. Another one na through contact. You shake somebody, you sit down with somebody, when you get the virus, you no go fit get am even though you dey sweat. And another one, say una eat for the same plate or you use the spoon wey the person use, you no go still fit get the virus. So make you no fear. Say because somebody get hepatitis B and I know say e get hepatitis B, anything concern that person, I no go wan near am. The only way when that sweat, as I said, na if that sweat mix with blood, yes, you fit dey fear. But if it's just ordinary sweat, my brother, no fear. E no go fit transmit am to you. So Dr. Fred.
Yeah, thank you so much, Dr. Israel. If you they watch us for Facebook, I don't know whether we go fit take your questions or because Facebook they do somehow. So you go need to go to YouTube, sharply, sharply, run, enter my YouTube so that we go fit see your questions there, and answer you. We don't talk about how people say they get them. We they try work with time, we did very fast. But one thing again, we say we mentioned that some people feel get them and they no go really know, say they their body. The issue don't talk about where they blood and other things. But when we say person get the hepatitis B infection, now death sentence, it means that your life don't spoil. No. Because as soon as the virus enter the person body through any way, your soldiers in your system go first try to see whether they fit fight them. Try, try, try. If they are lucky, they fit fight them. Clear am off. You no go even know, say this thing, dey your system. But sometimes they no go fit fight am. The thing go just find one way, sit down inside, dey your system. And as e dey that system, fit come dey cause some kind issues like cold, headache, body pain. You don't understand. You no fit chop, and many symptoms. So those different symptoms wey be like say, if you no dey careful, you fit dey call am malaria sef. Some people go dey tell you say na typhoid. It looks like any other condition. But later on, as the sickness come dey sit down, the infection fit come dey tear apart, e fit come dey affect the liver, come dey cause you other kind sickness. Wey be say when we come see am, our mind will now point to the fact that we need to test you and confirm if this is hepatitis B or something else. Now I want to make mention of something. No be say as you dey watch us right now, you will wan come go dey test yourself. You won't go test yourself. No. It's important that if you hear any of the symptoms we will go mention now, wey look like hepatitis B, it's important you speak with your doctor. So we are not here to tell you if you hear this thing now, go lab, go test, go define medicine. No, we will never do that. We will ensure that you enter hospital and make your doctor check you. But we just want you to take note of these things in case you see them. If it be sign say maybe something don't they do this person for a liver, or maybe na hepatitis B they give and this one one of them person fit they complain of abdominal pain, right-sided abdominal pain, belle fit just the pain am for the right side, you understand, because the liver is located at the right upper quadrant. Person fit they complain. Sometimes that is when it don't go far. Person fit get yellow eyes, fit get problem with the skin, fit dey itch and many many other stuff. I don't know whether Dr. Israel get one or two symptoms to add on top this, so that we go fit take some questions, because some people they ask us questions, but I no fit take them here. So maybe we just talk about the symptoms and then we will take their questions. Dr. Israel, please continue.
Okay, yeah, those symptoms when Dr. Fred mentioned, and as at this point, the thing don't really affect the liver so much. And the first one, this one fit never affect the liver so much, that be the abdominal pain. Sometimes not just only the right side, they can even do the middle. Some people they confuse and say na ulcer.
Also,
Some
yeah,
people
yeah,
feel they
yeah.
confuse and say na ulcer. So in some cases, not be ulcer, fit just be saying na your liver na get problem.
That's
Weakness,
true.
body weakness, and the person go dey very tired, weak, and all that. Yeah, some people go eat food and the food not go digest well for their body, because this time it don dey affect the liver, because the liver
Mm,
dey very important when it come to um food digestion, food digestion and absorption of food, because of the enzymes when they produce them. Dr. Fred already talk yellowness of the eyes. Sometimes their skin go dey scratch them, they'll get itchy skin. Sometimes their skin go come dark pass normal. Some of them when e don go worse, when e don affect the liver, say they don dey get liver cirrhosis and all that, their stomach, their belle fit come big, they come dey even dey get line, veins go come dey show for the belle. As at this time, e don already go far. That's why most hospitals, once you come with any symptoms like malaria symptoms, or anything wey cause say belle dey pain me, or any symptoms, one of the thing wey dem go still wan do for you na to just quickly check the
mm,
check for hepatitis. Because we talk and say person fit get hepatitis and nobody, dem no go know, and dem no go know. And also this one also bring to all healthcare workers. We might use this medium just to talk to healthcare workers. If you dey work for hospital in any form, you dey work for hospital, whether you be doctor, you be nurse, you be lab scientist, whatever you be, but you be healthcare worker working in the hospital or working in the public field, working in a place where you come in contact with blood or blood product. It is very very important, that you check for hepatitis, for yourself. You do hepatitis B test for yourself and you take the vaccine, because one set of people when they quick get am na healthcare workers, another set of people na men when they have sex with men, and every other persons can be infected. But um people wey dey work for hospital, they are really at high risk, because as Dr. Fred don still first talk am, the virus no dey quick die. The virus fit dey blood for a long time. Dat na one way wey dey even bad pass HIV. Even though you drop hepatitis B blood for ground now, dat virus fit stay for a longer hours than HIV, when you drop blood wey dey infected with HIV. So
mm.
please, for those working in the health care sector, please abeg, you just need to check for hepatitis B and go and get the vaccine and protect yourself and your family.
You don't hear. Thank you very much. Now we get some questions and we go take question. I get might just take one so that we go engage. But if you dey watch us for YouTube, like this video and share. If you dey YouTube now, you dey see us for YouTube. Click like. And then if you dey Facebook, problem enter YouTube quickly. Make we fit see your comments because Facebook they misbehave. So this person is asking us a question. It says can a man and woman who are hepatitis B positive get married? You are hepatitis B positive, and maybe the woman is negative, or you are hepatitis B negative, and the woman is hepatitis B positive, or the both of you are positive. You can marry. Oh. Nobody talk say because you are hepatitis B positive, you no fit marry. You fit marry. But the problem is that our people no dey like won't go hospital see doctor, make them check them. Most times, our people would like sit down, ask questions for house, for road, but you can get married. If you no go hospital, see your doctor, make them check you and find out whether one or two things they go on. Now there problem fit come dey. So whether you are positive and the person wey you wan marry dey negative, or you dey negative and the person wey you wan marry dey positive, you can still marry. However, you go need your doctor to follow you up and guide you. I no know if Dr. Israel get anything, then we will now continue with the tests and the treatments. Abeg continue, Dr. Israel.
O- Okay, I believe maybe when we dey talk, they go, we may still answer most part of this person of this question. Yes, you can actually get married whether you and your partner they positive, hepatitis B positive. You guys can get married, and you even give birth to children that are negative. It is
Mm-hmm.
possible. Now, if as Dr. Fred talk, even though one partner is positive and the other one is negative, una go still get you can still get married. Then the only thing is that the partner will be negative. It will be good for that person to get the vaccine. Yeah, just take the vaccine. Once you take the vaccine, you are protected, and you will not be able to get the virus again once you are vaccinated. So,
Mm.
okay, Dr. Fred, we can continue.
Yes, yes, yes. Go ahead.
Okay, and the test for hepatitis, most of the time we normally dey do our normal hepatitis B surface antigen test. Surface antigen test. Once it's positive, it mean say that person dey positive. Yeah, and after that, sometimes we now gat to go for other part of the test, the profile and the viral load. Now, the profile fit come tell us if this person really when this person don dey infected, if this is an acute case or if it's a chronic case, or wetin we dey see say na positive na just the vaccine wey e take, na the antibodies wey e don already form, and then now we dey see like positive. Because sometimes when you don take the vaccine is to form the antibodies. And for some person fit even go do the test and e go be say na the antibodies na just dey show. So that's why we need to also do the profile to be able to tell us, is this hepatitis B, is it causing problem, or if it's just there doing nothing. Then the profile go come still tell us how much is the virus in the body, in the blood system. Is the virus very much, or is the viral load very, very small? So, but it is good that once it is positive, whether it is acute or chronic, and you have room to start medication, it is very better that you start medication. You start your medication as soon as possible. So when you dey take your medication, yes, that will bring me to treatment and management of hepatitis B. So when we talk about the management of hepatitis B, as I said, there are the wetin we fit take treat, wetin we dey take manage hepatitis B na antiretroviral medication, and antiretroviral, yes. Na we dey use take dey manage hepatitis B, because it's a viral illness, so you use antiviral take treat, take manage am. But you should know this, that e no get cure, as we said,
Mm.
e no get cure. However, you can take this medication, you fit don take this medication for a long time, and you go achieve wetin we dey call remission. You go achieve wetin we dey call remission. E just be like when people get cancer, e get where
Mm.
dem treat am reach, oh, this guy don dey remission. When we say remission, e mean say this person don achieve that state wey e be like, wey e be say this virus no dey do anything again for e body.
Mm.
E no dey do anything, e no dey affect the person, e no get wetin e dey do, e just dey there, e just dey there dormant, no dey do anything serious for the person body. And as at this point, e also don reduce the way when the liver go for take dey damaged. E don reduce am, and all the effect when this virus suppose cause for the person body, e don reduce all of them. So when you get to that stage, we dey call am remission. No be say you dey cure, na remission we dey call am. Also, e get some set of person, wey be say dem don take this drug for a long time, dem don take the antiretroviral for a very long time. This dem come lost this hepatitis B surface antigen. yeah, because of the medication wey dey take, because dem don take am for a long time, the hepatitis B surface antigen go lost to the ex ten t to when dem come go test again, dem go dey see negative. Yeah, when you reach that stage say you come go test you dey see negative, one thing you should know is that yes, thank God, yes, you have gotten to that stage, but that no stop you from continue monitoring yourself. And it is very important that even when you get to that stage, say you no come see, you check, e mean say this person don lost the hepatitis B surface antigen, say the test kit no dey fit pick am again, but that is not 100% say this person don cure. Only
Hmm.
wetin e tell you is that make you continue to dey go hospital and make your doctor dey monitor you. Make your doctor dey monitor you. Another thing is that you should build up your immune system. You should also try to manage your sharp. This one na ways to prevent it. Manage your sharp, make sure say na you get your sharp, people not join you dey use am. And also for health workers, use universal precaution is very important when you are dealing with any client. Universal precaution is very, very important. And we no go talk prevention without we not talk about taking of vaccine. So hepatitis B, thank God, hepatitis B na one of the viral illness wey get vaccine. So the vaccine dey very much available in many primary health center for Nigeria. Hepatitis and even some private hospital, hepatitis B vaccine e dey there. So it's for you to make yourself available. Before dem even give you the vaccine, dem go first test you whether you dey positive or negative. Because if you dey positive, there is no need giving you the vaccine again. But if you dey negative, that is when they will give you the vaccine. And this vaccine na 3 doses. Yeah, 3 doses. So you take the first dose 4 weeks later, you take the second dose, then the last dose is 6 months later. And most studies will say after that you are covered for life. Some will say you are covered for 10 years, some will say for 20 years. Yeah. So it is very important that we take the vaccine. For as many people wey never take the vaccine, as far you don dey hear say we dey talk about am, it is very good say you go take the vaccine, make you protect yourself, not just yourself alone, but you protect people wey dey around you. Dr. Fred.
Yeah, thank you so much, Dr. Israel. E get this comment wey we dey always hear many questions about hepatitis B. I get hepatitis B. Abeg, wetin I fit chop? They say make I no chop this, they say make I no chop that. Before we go answer that question, I want you to share this video because it dey surprise me how you dey see say we wan answer you, guide you, answer many questions, but you no dey share. So if you know say you dey watch us for YouTube, share this stuff, so that people go know about hepatitis B, wetin dem go do, wetin dem go chop, and as we talk about the vaccine, you wey no get am, you wey never collect the vaccine, e go good make you go get yourself tested first to know. And if you dey negative, make you do wetin? Make you collect the vaccine. Now, somebody asked me for my private community, and I believe say the person dey watch me here. The person dey my private community. Some people go just dey here, you no go join. So that's why I'm answering the question because this person dey see me. He say he get hepatitis B. Which food he go chop? They say make you no chop this, they say make you no chop that. So we won't break them down for you. First of all, if you get hepatitis B infection, just like what Dr. Israel said about the medicine, that one they extremely important. About the viral load, extremely important. Even the liver function, important. Then you go need to avoid anything wey go affect your liver negatively. Anything wey go make your liver no function optimally. Anything that will affect your liver, that will reduce the function of your liver or will damage your liver, those things you need to avoid. We know many of them. Mostly the things wey we dey chop. One very popular one na alcohol. And then we dey encourage people to be mindful of the medications you take. Ensure that a doctor is aware. Some people wey dey go take concussions, herbal concussions anyhow. You and agbo, una be 5 and 6. Gradually, you are destroying your liver. Small, small, you no go know. Then it go also the importance that you take care of your immune system generally. You do things wey go support, wey go build your immune system. Now, few days ago, I be yesterday or 2 days ago, I made video about how to support your immune system. So those are the things you go do. And if you do all these things, the hepatitis B might just be in your system. E no go do anything, e no go multiply, e no go disturb you. But if you lose guard and you can't talk, say, waiting this boy they talk, I better forget. And then the virus come multiply. Now there, if he can give you some of the problems where we don't mention. So because say you have hepatitis B, it's not a death sentence. You can't dey cry. Say my life is over, my life don't end. Capital no. Eh? Now, Dr. Israel, I want to put this question here so that you go see him and then you go comment about him. He said, Doctor, please, my brother had it, but after treatment, but after my brother had it too, but after treatment, can we sleep on the same bed with him?
Okay, when they talk about people that can get infected and also where you can find hepatitis B, I also talk this to say you even when person get hepatitis B, you can shake the person, you can sit with the person. It simply means that if you can shake the person, you can sit with the person, you can lie down in the same bed with the person. We know say as I said yes, the hepatitis B can be in the sweat of that individual. However, it's not enough to cause a transmission. So e no go fit transmit am through just that sweat wey dey im body, because that sweat fit not dey enough, e no dey enough to carry the virus to transmit am to another person. The only way wey that transmission fit happen is that when this person get that sweat is mixed with blood, um na the person fit transmit am. So yes, you can actually sleep with your brother for the same bed. You can actually sleep with your brother for the same bed. You no need to dey fear anything. You no need to dey fear anything. As we said, now you need to also know say even though your brother you say they don treat am. I know I understand say you believe say your brother don cure, but remember what we just said. Hepatitis B no get cure, but it can be in the remission, and that does not stop that your brother should always go for checkup. He should always go for checkup. Make dem dey check am all the time to find out if there's any problem to the liver that nobody is knowing about, or and how everything dey go.
Hey, thank you, Dr. Israel. Now, I want to take questions. We dey take your questions now because we dey work with time. But you wey dey watch us for Facebook, we no dey see your questions. I don't tell you, say, try to come YouTube so that we go fit see your comment there. But we know they see your comments. We know they see your comments. That is it. Now, so let's talk about prevention. We don't talk about the area of vaccination. You go take the vaccine. You go take them after like 4 weeks. Then after like 6 months, you take your vaccine. The doctor don't break them down for us. So how can we now prevent? Make we know say we know get them. Dr. Israel mentioned health workers. I want to believe you also mentioned sexual life. Sexual practices, protection, know they share sharp objects. These are some of the things you need to know about hepatitis B. And then we talk about say if person get them. Hey, get one questions where they always see. I don't know if anybody go ask us, but make I just talk them right now because of the people where they follow me talk since where we're about hepatitis B. Dr. Israel, apart from the antiviral, is there any other cure for this hepatitis B or any other thing? Because some people go tell you, say, herbal medicine go cure am. And when we try to make them understand that the cure, no, they look as if say we no one help them. So I just want me to throw light on this one again because I don't talk about them before to some people where they follow me privately. Say, they
Okay.
now just to take care of your immune system and the antiviral medication. Go ahead.
Okay, sometimes when we come dey talk about medication, I dey believe I dey sometimes dey imagine if most people they think as I dey think. Imagine say they go bring one herbal medication, just one. They go tell you say e go kill, e go e go cure e go cure malaria, e go cure typhoid, e go cure diabetes, e go cure hypertension, e go cure HIV, e go cure hepatitis B, e go cure syphilis, e go cure gonorrhea. Only one, just one, then e go boost your immune system. Just one herbal medication, just one. One. Wetin dem dey try tell you say dat herbal medication e get antibiotics, e get antifungal, in fact e get everything. And I begin to imagine how is it possible? How dem take make dat drug? If dem don make dat kind drug, why scientifically we never fit produce something, one medication like dat wey go cure everything? If you just we fit call am how shall I call am, super medication or super drug
Hmm.
wey go just cure everything. So why I dey talk dis one, dis is just to let you know say all those herbal medication wey dem dey tell you say e go cure the whole world, it will not help you. And remember say we tell you, Dr. Fred talk one thing say things wey you need to stop for food and wetin you take in. One, e mention alcohol. Two, e mention herbal concoction. um Why? Because the liver, those things dey give the liver a lot of work to do. So if you come go dey, and na the liver na the hepatitis B dey affect. So if
Hmm.
hepatitis B affect the liver, you come go still give yourself all those many concoction to dey destroy dat same liver when hepatitis B don already knack. It mean say you dey tell yourself say you wan kill yourself on time. So just to prevent those many things, it is better you stick to the antiretroviral medication when science don, when we don go through, we don do test for am, we don pass through many pharmacological trial and all that, and e come out, the world come see am say dis drug e dey safe, then we come dey use am. And it is better you go for that than to come dey go for all those medication wey you no know where dem for make am. Dem come dey tell you say e go do dis, e go do, e no go do anything. So apart from antiretroviral medication, no other thing dey wey you go fit take wey go cure, wey go treat, no be cure, wey go treat hepatitis B. Remember say even the antiretroviral medication no go 100% cure hepatitis B, but e can take you to that state of remission, and e can also take you to that state where your hepatitis B surface antigen will be lost. And when e lost, so that to that extent that when you check your hepatitis B, e go dey show you, negative.
Hmm.
So apart from the retroviral medication, all those herbal concoction no go work.
Yeah, thank you, Dr. Israel. They've tried check here whether I go see the other comments. So they had me. Let me see if I go see comment here. The comment for Facebook, no, they show up, no, they comment. But what I noticed is that most of somebody's asking us, it says, what about those born with it? And those that are born with it, as we have said, now to continue with their management, their treatment. Nobody talks say because a woman carry belle, she can't born pikin, the pikin can't get the pikin life is finished. No, there is treatment. They will follow the pikin up. But the problem is that most people no go hospital, make them check them. Hmm? Now there the problem there. Nobody talk say because them born pikin and the pikin get hepatitis B, the life is over. No. And just like how we also mentioned again, that if you take the medicine as prescribed for you, the virus can go so low, you go they think say you are cured. But somebody was asking me, I think this week, say, he know somebody, they test are nice, they say, the person is cured. What if now the medicine wey they take, antiviral medication, now suppress the thing so low? Or what if the person did na acute phase e dey? So you have to be careful, with these things we they tell you, so that go collect one information online. They will tell you may you go grind ginger and garlic. And then when you drink all these ones, your problem fit come worsen. So if you dey listen to us on YouTube right now, I know I can see your comments here. Put in the comment section. Tell us wetin you don't understand. Now let's talk about few things that can happen. Those complications of hepatitis B, Dr. Israel. What can really happen if this person they advise am make e take medicine, the person no take medicine? What can really happen when the virus come multiply? When the virus multiply, it can very bad affect the liver, and many things can happen in the system. Also, Israel, please let's talk about this. Let's talk about the effect. So
Okay.
the liver can fail. And go ahead, I beg.
Okay, now when we talk about the effect of hepatitis B, let us look at all the complications of hepatitis B. So you know, one of the things is that when you don't dey take you not take the medication and the viral load is high, it means say you go fit transmit the virus. You go fit transmit the virus very easily. Yeah. Okay. Before I continue, for that question when Dr. Fred dey try to answer, also remember say there are ways to prevent it so that the pikin sef no go even get am from birth.
Hmm.
So it's also very important, because once you born that pikin, maybe the mama get, e come born, as e born that pikin, e need to give the pikin one medication wey we dey call immunoglobulin. So if you give that pikin that immunoglobulin and you come continue with your normal hepatitis B vaccine for that baby, the baby no go get am. The baby no go get am. And also note, the mama go fit breastfeed. So make you no come say the mama no fit breastfeed. The only time wey the mama will not be advised to breastfeed is if the mama get cracked nipple, like e get injury for im nipple, wey be say the nipple, dis thing fit come bring out blood. Na only that time we fit say make the mama no breastfeed until that thing don heal. E fit come continue. Then the complication, when this thing, the viral don many, e go affect the liver and e dey affect am small small, because you know say the liver na one organ wey be like shock absorber. E dey collect a lot. When e dey collect a lot before you come decide say e don tire. That's the liver, because na im dey help us dey remove a lot of dirty from our body. So once the liver don fail, those dirty wey the liver dey help comot for our body dey help separate, dey help separate bad from good. Then you come push the bad go where dey go from comot. Those things the liver no go come fit do am. So many chemicals go come dey inside our body, and that one will lead to liver failure, liver cirrhosis. E can even cause liver cancer. Then some people come get bleeding disorder because their blood no dey clot again. Some jaundice go come dey, their eyes go dey yellow and their stomach go come swell, ascites go follow am, and sometimes they go also dey come down with some other infections, and some other infections fit also fit affect them. Dr. Fred say if you dey understand wetin we dey talk, make you drop am for the comment section just to let us know say yes, you dey understand, and you can actually tell us all wetin you don hear wey you understand from wetin we dey talk since. Dr. Fred.
Yeah, thank you so much, Dr. Israel. I want to believe that we don't break some things down. For you, we just they come right now because somebody just they join us right now. They ask some questions. Sorry, you go need to go watch from the beginning because we talk about how people fit take get this virus for their system. We talk about the way it will be if it enter your body in the beginning, how it will appear. We talk about when it don't go far. We also talk about the possible ways where they treat, and we mention that you not get cure. But when you tell people say you no get cure, they go vex, believing that you no want help them. And when they come waka, go drink all those chemicals, and those chemicals can't destroy your body, you will come back to the hospital with complication. We don't break them down. So if you know, say, as we they talk, Sophie, Sambo, and other people where they watch me, if you know, say you learn anything. By the way, how many people don't even get tested for hepatitis B? I think that one we're supposed to ask. How you don't test for hepatitis B before? You don't collect the vaccine? Oh yeah, oh. Wave your hand. I want to call your name now. I think that's the best thing. If you don't test for hepatitis B before, huh? Or you don't collect the vaccine, or yeah, let us know. Because it will not be enough to tell you about hepatitis B, whereas you have not tested yourself, you never take the vaccine, and you didn't listen. And then when the problem happen, after you come dey run, Dr. Fred, abeg, can I call you? Can I chat you? No, no, no. I haven't, but I will do so immediately. Thank you. Thank you. At least we know now, say we know with our saliva. Huh? Thank you very much. Oh yeah, I wait for you, the next person. Oh yeah, oh yeah, oh yeah. So if you get anything we want to add, it's almost time to round up. Before
Yeah.
we round, yeah, okay. Yes, let me see. Somebody says, thank you very much for responding to my question, because me and my partner, we are positive and it's giving me a lot of concern. We don't address your comments, so no need to panic, huh? And we don't address your concern. We don't tell you what you could do. You get okay. Pleasure, what?
Dr. Fred.
Hello.
Dr. Fred, did they hear me?
Oh my God. Sorry, your network. The Dr. Israel. Oh yeah, you're back. Can you hear me now?
I can hear you. Now your network spoil, not be my own.
Oh yeah, go ahead, go ahead.
I can hear you. Okay. Um, for those we never really check their hepatitis B status, it is very important say you check them. It is very, very important. Now, one thing is this, is that when we know something, when we go fit prevent, let's prevent it. Make we come know say na those ones wey we no go fit prevent, now we come dey try to dey patch ourselves with. When we know, okay, no, when we know say we get vaccine for something, we get vaccine for a disease as a prevention method, make we take the vaccine. So dat make we know say na only those ones wey we never get vaccine na we go come dey wait for make the vaccine come out. As I tell you, any vaccine wey I hear say e come out, I go take. I dey take. Mostly when I know say, oh, it's to prevent disease, I dey quickly go take. So please, if you have not checked your hepatitis B status, check it. If you are negative, please take the vaccine. If you are positive, please speak with your doctor, and your doctor know the next step to take. I also know the medication to give to you. I also know what and what to tell you. So don't dey fear anything, and nothing go happen to you. And nothing really happen happen to you. So I go just run through. Dr. Fred, you dey hear me? So I go just run through the wetin we dey talk since. I go just run through. I will give a summary of hepatitis B and our health. So that just to for mostly for those wey just dey join us. Just remember say this program na every 8 p.m. on Sundays to 9 p.m. So try not dey come late so that you go gain everything wey we dey talk from the beginning. For those wey don test and they are negative, please go and get the vaccine. It is very important. So today we discuss hepatitis B. And we say hepatitis B na one of the virus with the family of hepatitis. Say na viral infection na hepatitis B be. I would say it's just almost like HIV, but not be say na HIV. And we say hepatitis B affect mainly the liver, and the liver na im dey deal with. And when e don deal with the liver, every other organs and every other part of our body fit hear am, because the liver dey play a large role for our body. So because it talk say hepatitis B can e dey main the part of our body wey dem go fit see hepatitis B, e dey our blood and blood product. So people wey dey infected, you go fit see am for their blood and blood product. For the male, you fit see dem for the semen. Female, you fit see am for the Pecos fluid. Doctor say e dey breast milk, e fit dey sweat, even dey saliva. But the one wey dey breast milk, dey sweat, dey saliva, e no reach to take e no many reach wey go fit give person hepatitis B. So e mean say you fit stay with somebody wey get hepatitis B, you fit sit down with the person, you fit shake the person, even when the person dey sweat, you fit stay close to the person, you no go get the virus. E also show say you fit even kiss somebody wey get hepatitis B, e no go fit transmit the virus to you. And e also good for you to know say mothers wey get hepatitis B can actually breastfeed their children as well, so far the nipple no get injury and the nipple no dey crack. And also they go must make sure say they give their baby the necessary vaccines and the necessary medication that the baby need to so that make the baby for not come down with hepatitis B. We also say that other ways wey people fit take get this hepatitis B, one, through unprotected knacking. Unprotected knacking, whether na man to man o, man to woman o, or woman to woman o, that no concern me. Knacking na knacking. Unprotected form of it, you go fit get this virus. And also blood transfusion fit give person the virus. Another way na through mother to child during childbirth. So other ways na sharp injury, needle stick injury, sharps and all that. And if you go use some brush of somebody wey get hepatitis B, you fit actually get hepatitis B, because if this virus don dey the brush and you come go use am, you fit actually infect yourself with hepatitis B. So wetin come be the signs and symptoms? We mention say some of the signs and symptoms are just the normal signs and symptoms wey people dey feel if they get malaria, if they get typhoid, if they get every other form of febrile illness. They fit dey feel hot, weakness, tiredness and all that. And this person fit dey think say na so malaria dey worry am, whereas no be only malaria. And also this person fit even get stomach pain. And sometimes you will think say na ulcer, and e fit not be ulcer. So that's why it's very important. It's good once in a while do your liver function test, do your hepatitis B screening, do all those screening, and you will just be protecting yourself from so many things. So we come dey look about the prevention, and one of the way to prevent is to get the vaccine. And we say the vaccine is made of 3 doses. The first 2 doses taken within 4 weeks apart, then the last dose is 6 months later. So taking the vaccine will actually protect you. And we urge every healthcare worker that it dey very important and very good make dem get the vaccine. I hope say we dey hear me, and I hope say we dey understand wetin we dey try to talk. And we say also if person get hepatitis B wey don dey chronic and you no treat am, you no take medication, first of all, e good make you know say the medication wey you fit take for hepatitis B na antiretroviral medication. That if you don take this medication in a chronic state, when the person get chronic hepatitis B, you don take this antiretroviral medication, reach a particular stage, this person fit come get wetin we dey call remission. E mean say e don reach that stage wey e be like say the virus no dey e body again. Or some few persons, they fit come lost the hepatitis B surface antigen. That is, if they check their self, go do test, the test go dey read negative. So these people go say, oh, they are cured. But the main sense na remission na dem reach. And that go also let you know say even when you get to that stage, e good say make you dey go for checkup once, so that make your doctor for dey check you and dey find out any other thing wey fit happen, or whether this thing go even come back again. Then it's also good for us to know say our immune system is very, very important. So make we do everything possible, everything wey we know say we go fit build our immune system. It is very good that we do them. So it means say we go stop all those negative stressful activity, alcohol intake, smoking, taking of native concoction, and so many other things, even some medications that we take that can affect the liver. We go need to try and stop them or reduce them to the barest minimum. I think we have gotten to 9 p.m. I believe say we don try, we don try break down wetin hepatitis be. And we don still notice say some persons actually don answer, some persons actually don do their test, some never do their test. And for those wey never do their test, as we said, we encourage you do your test and get the vaccine if you are negative. For those wey don do the test and you are negative, it is very good for you to go to the next step. The next step na to go to any primary health center, ask dem for hepatitis B vaccine. Depends on the place wey you go, you may be asked to pay one or two small small thing. Den treat yourself. Everything is okay. Den treat, take the vaccine so that make you for that one na the best way to prevent yourself
Yeah.
from hepatitis B. Dr. Fred,
Yeah. Thank you so much, Dr. Israel. Network show me shege, NEPA show me shege.
yeah, I notice.
Thank you so much. Thank you so much, Dr. Israel. Thank you very much. I appreciate you. And you will listen to us. Thank you. I beg everything we don't talk, please take am serious. We dey here to ensure that you don't joke with your health. And finally, anybody we want join my private community, you want to join my private Telegram, look for the link on my page, subscribe and join. Like I always tell you, good life now waiting. Good life. Na sense. Take care and have a wonderful day. Bye bye.
Bye bye.